And thank you all for joining us today. My name is Meg Snead, and I serve as Acting Secretary of the Pennsylvania Department of Human Services. We are here today to mark an extremely important and necessary step forward in access to life-saving behavioral health and crisis innovation services nationwide. On Saturday, July 16th, 988 officially went live around the country as the 3-digit call code for the Suicide and Crisis Lifeline, what we formerly called the National Suicide Prevention Lifeline. When Pennsylvanians call or text 988, they will still connect with the same 13 crisis response centers in Pennsylvania reached when calling the 10-digit lifeline. The change over to the shorter, quicker to remember 988 makes life-saving suicide prevention and crisis response support easier to reach than ever, something we know will make a difference for people in difficult circumstances. 988 will connect people who are experiencing a mental health crisis or considering suicide to trained, compassionate crisis response professionals who can talk through their situation over the phone, deploy mental health crises teams to assist a person if they're available in the caller's area, or connect the caller to additional local resources. They can also deploy emergency response professionals if there's a threat to life or safety. And beyond helping people in crisis themselves, 988 can be a resource for people looking for the best way to help a loved one or someone else in need. 988 can also connect people with specialized services like Veterans Crisis Line and assistance in Spanish. As a nation, we've made progress in recognizing how essential mental health is to our overall well-being and quality of life. Mental health is health. Continuing to build a robust network of supportive resources and easing barriers to these resources is an important part of this work, but we all must continue to do what we can to foster more open, compassionate dialogues around mental health, crisis, and suicide. Each of us can and must be a source of support for our loved ones and people throughout our lives. Think about the number of people you interact with every day. There are endless opportunities to foster connections, be a source of validation, and help people feel less alone in whatever they may be going through. Checking in on people, sharing resources and stories through your networks on social media, and helping people feel safe sharing their own experiences are simple steps, but they can help someone feel safer working through their own challenges and circumstances. Our actions can have a powerful impact that can be a catalyst to helping someone who needs extra help to get the care, treatment, and support that they deserve. So please share this resource, and if you're worried about someone you know, don't be afraid to call or text 988 yourself. This outreach can save lives, and now that we have this easier-to-remember number to connect to help, we can all play a role in letting people know that their lives are important, and no matter what they're going through, the first step to getting help that they deserve is a call or a text away. Thank you again for joining us, and I'd now like to introduce my colleague, Dr. Denise Johnson, Acting Secretary of Health.
Thank you very much, Secretary Snead. I'm Denise Johnson, the Acting Secretary of Health at the Pennsylvania Department of Health and Physician General. I'm glad to join my colleagues here today to talk about the 988 and talk about the important resource that this affords us. I am an OBGYN physician, and I spent the large part of my career caring for individuals at vulnerable times in their lives, and that includes before, during, and after pregnancy. And I know that this vulnerable time can cause lots of stress and need for resources. Mental health needs are just important as physical health needs, and so that's why this 988, where individuals can seek help and their loved ones can seek help with them, is really so important. We know that this is also a time that we are recognizing Black Maternal Health Week, Black Maternal Mental Health Week. And in Pennsylvania, the maternal mortality rates are really astonishing. It's estimated that about 82 individuals out of 100,000 live births lose their lives during pregnancy or around that time. But for Black individuals or people of color, that rate is twice as high. It's 163 per 100,000 births. We can and must do better. We know that in the maternal mortality report that was published for 2021, mental health issues are a prime cause of maternal mortality and a contributing factor. And so this is something that needs to be addressed. There are many factors that contribute to that. That can include systemic racism, lack of employment, association with exposure to violence, childhood traumas, as well as inadequate high-quality care. Those are all things that we can do something about, but we also can provide support and give individuals a lifeline to reach out if they're having crisis. And so 988 is a great step in that direction, and we applaud our colleagues for promoting that to make sure that people have access. Thank you very much. I'm going to turn it over right now to Deputy Secretary Kristen Hauser.
Good afternoon. I'm Kristen Hauser, Deputy Secretary for the Office of Mental Health and Substance Abuse Services at the Department of Human Services. And our office has been partnering over the past several years with Thomas Jefferson University to help the Pennsylvania call centers that answer the National Suicide Prevention Lifeline and enhance the capacity of Pennsylvania centers to answer calls that are placed from Pennsylvania-based phone numbers. The first Pennsylvania call center joined the Lifeline back in 2006, just 1 year after the Lifeline launched. And since then, we have gone through onboarding additional other centers, growing over the years until now we have this network of 13. And there are staff that are available to answer those calls, whether they're dialing the 988 new number or the previous 10-digit number. Both will remain in existence. We've received numerous questions about our readiness in Pennsylvania to answer a projected surge in calls now that 988 is being advertised. And I'm pleased to say we're quite confident that we are ready. Back in 2017, our capacity to answer calls from Pennsylvania-based phone numbers wasn't that great. We had only 7 centers at the time, and we were answering just under 30% of Pennsylvania calls. But since then, we've onboarded another 6 centers. We've developed a backup system based in Pennsylvania so that if the first Pennsylvania center is not able to answer, it rolls over to one of 3 regional centers who serve as that safety net. And Pennsylvania callers are now being answered at a rate around 85% of the time. That actually means that we are one of the best in-state answer rates in the country, which is why last Friday, Secretary Becerra from Health and Human Services came to Philadelphia as part of his tour to announce the launch of 988. The Federal Substance Abuse Mental Health Services Administration, or SAMHSA, has asked states to achieve a 90% answer rate from in-state calls during the first year that 988 is active, so we are just about there. The Pennsylvania call centers are able to connect callers to local mental health, substance use, and other behavioral health resources provided by counties. They're able to connect with mobile mental health teams across Pennsylvania if an in-person response is deemed necessary. And they're trained to work with callers to get their location if the situation seems to demand that local police or other emergency responders are needed, and they are able to connect with appropriate 911 call centers to dispatch that help. We're also continuously working with PEMA around enhancing our 911 coordination. Presently, 988 does not have geolocation services, and as we said, we've, through the years, always been able to work with callers around doing the best that we can to get their location when those emergency services are needed. However, we also know that between 80 and 90% of callers get their needs met from that communication with the counselor on the phone. So the location is not what is most important, it's getting the support that a person needs. 988 is really more than just a phone number. It's really a gateway to reach a continuum of crisis services. People need someone to talk to, but they also may need someone to respond to them in person and somewhere to go. And the Department of Human Services and the Office of Mental Health and Substance Abuse Services is focused on supporting counties, emergency responders, crisis mental health providers, and other stakeholders in that system to enhance our existing services and build a more robust system over the next 5 years. We've been fortunate to receive federal dollars from the Community Mental Health Services Block Grant to assist this work. We've also received funding from SAMHSA to support the workforce needs of the existing 13 call centers, and additional dollars from the Centers for Medicaid and Medicare Services to support planning for expanded mobile crisis services in Pennsylvania. This is all consistent with the vision that SAMHSA has for the nation. They recognize that enhancing services and forging new partnerships and identifying sustained funding to support these life-saving services takes time. So we are committed to seeing it through and increasing care in Pennsylvania. So last week, when Secretary Becerra was here in Philadelphia, he was reiterating the federal government's commitment to supporting states in the development of these services. And that's done in several ways. They've been excellent in connecting states with experts, with tools and resources, and with funding. But he also made it clear that state government needs to invest in the care of their citizens as well by committing sustained funding and supporting increased access to care. And for that reason, and many others, I am so pleased to introduce Representative Mike Schlossberg. He's been a dedicated voice and supporter of mental health and well-being in the General Assembly, and we so appreciate your partnership in enhancing mental health care in Pennsylvania.
Thank you, Deputy Secretary, and good afternoon, everyone. My name is Mike Schlossberg. I have the honor of serving the people of the 132nd District in Lehigh County as State Representative. I'm also House Democratic Caucus Administrator, and I'm the co-chair of the House Mental Health Caucus. So I'm in here in a few capacities today, but I'm so pleased to be here for a variety of reasons, chief among which is that I think 988 can help advance the story of mental health care and can really help show the need for additional resources in the mental health care universe. Let me bring this back a little bit to an individual level. One of the things that I certainly found in my own experiences with mental illness and with depression is that you can become convinced very, very easily that the issues are just in your head, that there's something that you're making up, that you're not fully battling with in an appropriate way. One of the things that 988 does, and I'd argue the biggest thing that it really does, is it can help drive down stigma and self-stigma. The federal government, state leaders standing behind me are now saying that issues related to mental health, to suicidality, to depression and anxiety, and a whole slew of mental illnesses, they're real. They're so real that we're creating a brand new number that's on par with 911. I want everybody who's listening right now to think about the destigmatizing effects that this project is going to have. By creating a 988 hotline, we're saying to individuals, your problems are not only real, but we believe that you are worth treatment and recovering and living a good life. Now, we've actually made real progress in the area of mental health, especially in this past budget. This past budget featured $100 million to schools so that they could deal with the slew of mental illnesses that have really popped up over the past few years. $100 million for adult mental health that's going to be addressed by a Blue Ribbon Commission that should be convening shortly, and a restoration of $15 million to go to counties. And that money can be vital to giving mental health and behavioral health care to people who need it the most. Now, that being said, my concluding message is this. This is a celebration. It's a good day. But I don't want anybody to think that our work is done. Far from it. When the federal government created the procedures for 988, they also allowed us to levy certain fees or taxes. And we could use that money to create more resources, more care, more counseling, and mobile health crisis teams for people who are in need of help. Now, just so we're as clear as possible about that, we're not there yet. There is no doubt that the legislature, the governor's administration, and everybody who is dealing with this issue has a lot of work to do in terms of making sure that we can continue to bring resources home to people who need it. The legislature put more than $200 million new dollars into behavioral health care. But thanks to years and arguably decades of disinvestment, we've got a long way to go before we get where we need to be. So again, today is a good day. It's a moment to celebrate the fact that mental health has become so much more prominent in the minds of policymakers across the United States and Pennsylvania. But let's be clear about this. We have a long way to go before we give everybody the care that they need. So thank you very much. And on that note, I think I'm going to turn it back over to Secretary Snead for questions.
Thank you, everyone, and thank you all for joining us today. Before we close and take questions, I wanted to recognize the people who make this support possible. Pennsylvania's 13 crisis response centers work every day to be there for people during their most difficult moments, and their work gives the hope and support that they need to get through those moments. As we extend the reach of the Suicide and Crisis Lifeline with 988, these teams will be there to support an expanded front line of mental health and crisis support. On behalf of all of us in the Wolf administration, I would like to thank our Lifeline Crisis Centers and their teams for the life-saving support and empathy that they provide every day. Your work makes more of a difference than you know. And if you're interested in getting involved in this work, you can visit 988lifeline.org to find a call center near you and learn about how you can join their team and support their work. Thank you so much, and we're happy to now take questions. Okay. Thank you, everybody.